Hi, everybody. It's great to see you again tonight. We are going to be finishing up the segment that we've been doing related to knowing yourself. Knowing yourself meaning to know your history, your family history, your medical history, your menstrual history, your sexual history, understanding your risk factors and how that may possibly contribute to what we know to be the causes for maternal death in the United States. Quickly, those causes include the following: 23% of mothers are dying due to mental health issues. This may be from suicide or from overdose, and this is happening within the first year of life after the mother has had her baby. The other 13% of women are dying from hemorrhage. 13% of women are dying from cardiac and coronary problems. That is affecting mainly the Black population. The postpartum hemorrhage is affecting mainly the Asian population. And other things such as blood clots and cardiomegaly are the other reasons. Most of these causes are preventable. And so we've spent time looking at all of the causes, looking at them individually, challenging ourselves to look at our own history so we can know ourselves. Last night, we talked about the normal changes that happen in pregnancy. Tonight, I'm going to review with you the danger signs. These are the times when you need to be in touch with your provider in an urgent manner. I want to also say, and to help everyone to think about this, when you have insurance, you are paying at every visit, you pay for the visit. That means that you are paying for a service. They are not paying you to come. As a matter of fact, they will charge you if you miss an appointment. So keep in mind, you are the one who's paying for that service. Therefore, you need to take advantage of that service, particularly when there are times that may require urgent attention. I've cared for thousands of women, and women will say that they don't want to call the doctor or the midwife at night. I say, call them. You're paying for them. You need to call them no matter what the time, whether it's midnight, 1 o'clock, 2 o'clock, 3 o'clock, 4 o'clock. I don't care. You need to call them because when you have danger signs in pregnancy, you need to be seen. If you're unable to get to your provider, go to the emergency room. If you're out of town, to the nearest emergency room, because these things need urgent attention. So let's kind of begin now and go through the different things. We talked about normal changes and normal complaints last night. Now we're going to talk about the dangers. So again, we're going to kind of start at the top of our head, because if I start there, I can remember as I go down. So the first thing is headaches. We all have headaches, and they're generally relieved easily with the use of aspirin or ibuprofen. But if you have a headache that is not relieved by ibuprofen or aspirin, then it's something to bring to the attention of your provider. So any bad headaches that you might have. Sometimes those headaches could be accompanied by changes in your vision, where you might have blurred vision, or you might have spots before your eyes, little flickers of things that are before your eyes. If that is going on, you need to also contact your health provider. Why? Because these are signs of what is known as preeclampsia, or many people will say the word toxemia. but the medical term is preeclampsia. I want to tell you that preeclampsia is nothing to play with. It can advance very quickly. It can advance to what's known as eclampsia, which can cause you to have seizures, and it can cause you to die. So it is nothing to play around with. The next thing that we want to go to is if you have any kind of shortness, like you're unable to breathe. I'm not talking just a little, I can't take a deep breath, but when you're having like really bad shortness of breath, that is something also that can indicate possible blood clot. It could indicate heart issues. This is something that you want to bring to the attention of your provider right away. The other thing, as we go down, we talked about nausea and vomiting last night, that is a normal sign of pregnancy, and that women sometimes can be very, really uncomfortable with the nausea and have some. But when you have vomiting to the point that you cannot keep food down, where you're unable to hold your meals, that is a problem. It is called hyperemesis, meaning emesis is vomiting. I'm vomiting too much. You can actually lose weight, become dehydrated, which is not good. And so if you're finding yourself where you are vomiting constantly, then that is something to call to the attention of your health provider. As we go down the body, if you begin to have really bad abdominal pains, it is possible for you to have abdominal pains for a couple of things. One is if you're having contractions too early. And I want to say one more time, do not play around with this. If you're having contractions too early, it could cause your baby to be born too early. Things could be done to stop labor if that is actually what's going on. The other is if there are any problems with the placenta or afterbirth, which is attached to the wall of the uterus. And keep in mind that this uterus is in your abdominal cavity during pregnancy. So if you begin to have really bad abdominal pains, do not ignore that. Get it checked out. Babies' movements. Mothers know the rhythm of their babies. They know the rhythm of their babies. I do not want to scare you, but there is a possibility of babies dying before they're born. It's called stillbirth. And when that has happened with women that I have taken care of, they will say the baby was not moving as much. And so if there's any question about your baby not moving as much, do not wait on that. Do not wait on that. What will happen? When you go in to be seen, they will place you onto fetal monitor to see what is going on, to see the baby's heart rate, to see how the baby is reacting. The same thing would happen if you were to have abdominal pain that could possibly be early contractions. You would be placed onto the fetal monitor and be able to see what is happening. Believe it or not, a bladder infection can cause you to have not just the bladder, but a kidney infection can cause you to have some cramping and some contractions a little early. And so you do not want to play with this, please. As we continue to move down the body, I think about any kind of bleeding from the vagina that is more than spotting. If the bleeding is bright red, if you have to put on a pad, please get attention to that. It could be a problem with, is the cervix opening up too soon? Is there a problem with the placenta? I'm bringing these things to your attention. Do you have any leaking of fluid from the vagina? And when I say leaking of fluid, when you urinate, you can hold your urine. But if you have any fluid coming out of the vagina that you cannot hold or you have any question about, you want to have that checked out. It could be an indication that the bag of waters has broken. Tests can be done to check to see if the bag of waters has broken or not. If you are to have pain, what I would call pain in the flank area on the right side or even the left side, it's kind of in your pain in your back, okay? Not lower back pain, but pain like midway in your back on either side. That can be an indication of a kidney infection. Your kidneys are located in that area in your body. It is possible to get a kidney infection. Remember last night I talked about how the hormones in our body will cause relaxation of muscles. That includes muscles everywhere in your body. So it is possible that you're more prone to getting a bladder infection during pregnancy because at the top of the bladder closes off as well normally. It can relax just a little, and there can be some bacteria that can get into the bladder, can stir things up, cause a bladder infection. And if that is not treated, it can go up to the kidneys and cause a kidney infection. So these are things that you really want to be very, very watchful of. I think I have covered pretty much. I'm just double checking. I think I have. I wondered if there's anyone, if you have any questions online. What I want to impress upon you is that I always say to the women that I work with, I'd rather you be able to sleep at night. It's better that you come into the hospital, get checked out, and be sent back home. Where everything is okay, you know everything is okay, then you can sleep, you can rest. But if you have questions, you're not going to rest. And so we would prefer you come in early as opposed to waiting and coming in later, where there could be problems that could have been treated or avoided. So this is the end of our section of the presentations and our conversations, let's say, on really knowing yourself. I want to now move into understanding the healthcare system, which we're going to start talking about in the next few evenings. So if we know ourselves, if we know our risk factors, if we know what is going on, there's one thing I forgot, swelling in the hands, the feet, face. That's the other one I forgot. If you were to notice swelling in your hands, in your feet, in your face, these too are signs of possible preeclampsia. And again, that would be checked out with your midwife or your doctor whom you're seeing. That is the other one. That is a sign, as I mentioned, of preeclampsia. So there we are. These are the things that we'll cover for the danger signs in pregnancy. We will start, as I mentioned, on understanding the healthcare system, like who are all these providers? We will talk about all the different providers based upon your health risks that you have looked at for yourself. Who can you hire to care for you in pregnancy and in labor? We're also going to talk about how to find a hospital or a health facility, whether that is a birth center, whether it is a hospital. There are different tiers of hospitals, and different things happen at different tiers of hospital in terms of personnel. Are you a candidate for home birth? We will have a conversation around all of those things. And I am hoping, as I mentioned last night, to have some more live interviews. I feel like I've been at my dining room table for many nights now. It's time to get out in the field and talk to more. I have gotten some arrangements to talk with some dads. I'm going to be very excited about that. There's also a local organization that works very diligently with mothers and families. We will have some opportunity to talk with them. So those are the plans. I want to let you know that I will be putting out a free ebook. So I hope you will find that ebook something to be enjoyable. Just continue watching. If you have enjoyed the information that I have shared with you tonight, please like my channel. Please subscribe to my channel if you haven't done so already. And please share this channel and this information with your girlfriends, your aunties, your nieces, your nephews, the guys as well, not just women, but the guys as well. So thank you again. I hope you have a great evening, and I look forward to talking with you tomorrow. Have a good evening. Bye-bye.